Diverticulosis and Diverticulitis, an in-depth exploration. Diverticulosis involves the formation of small pouches, known as diverticula, protruding through weakened areas in the walls of the colon, particularly in the sigmoid colon on the left side of the abdomen. These pouches become more prevalent with age, affecting approximately half of individuals in the United States between 60 and 80 years old. Notably, only 1 in 10 develops diverticulosis by the age of 40, with an equal occurrence in both women and men. When these diverticula become inflamed or infected, the condition progresses to diverticulitis, potentially leading to severe complications. Symptoms: while diverticulosis often remains asymptomatic, some individuals may experience mild cramps, constipation, or bloating. On the contrary, diverticulitis manifests with more pronounced symptoms, including steady abdominal pain, tenderness to pressure in the lower abdomen, especially on the left side, fever, nausea, vomiting, chills, cramping, changes in bowel habits, constipation or diarrhea, and sharper pain with breathing or movement. Additionally, lower intestinal bleeding may occur in diverticulosis, resulting in weakness and dizziness due to blood loss. Diagnosis: the prevalence of diverticulosis increases with age, and diagnostic procedures such as colonoscopy, abdominal CT scan, or barium enema are essential for detection. Diverticulitis, in contrast, typically presents with noticeable symptoms, prompting a thorough medical history inquiry, assessment of bowel habits and diet, and a physical examination. Abdominal tenderness is evaluated through palpation. Depending on symptom localization and abdominal findings, a diagnosis may be made without further tests. However, in cases of uncertainty or suspected complications, additional studies, including blood tests for infection signs and abdominal CT scans, are ordered. Expected duration: diverticula persist unless surgically removed, rendering diverticulosis a lifelong condition manageable through dietary adjustments. Symptoms of diverticulitis or bleeding may resolve within days after treatment or persist, depending on the severity and complications. Prevention: a fiber-rich diet significantly reduces the risk of diverticular disease. Daily fiber intake of at least 20 grams, preferably from fruits, vegetables, and grains, is recommended, with gradual increases to avoid bowel pressure. Physical activity also contributes to lower diverticulosis risk. Previously, avoiding nuts, popcorn, and seeded foods was suggested, but evidence supporting this restriction is inconclusive. Risk factors and prevention strategies for diverticular diseases. Obesity and weight management. Risk factor: obesity is a significant risk factor for diverticular diseases. Excess body weight, especially abdominal fat, increases pressure within the colon, potentially contributing to the formation of diverticula. Prevention and management. Adopt a balanced and calorie-controlled diet to achieve and maintain a healthy weight. Engage in regular physical activity to promote weight loss and prevent obesity-related complications. Consult with a healthcare professional or a registered dietitian to create a personalized weight management plan. Hydration and regular bowel habits. Dehydration and constipation. Inadequate hydration and irregular bowel habits can contribute to constipation, potentially increasing the risk of diverticular diseases. Insufficient water intake may lead to harder stools, making bowel movements more challenging. Prevention: ensure adequate daily water intake to keep stools soft and promote regular bowel movements. Aim for at least 8 cups, 64 ounces, of water per day, adjusting based on individual needs, climate, and physical activity levels. Establish a consistent bowel routine by allocating time for bowel movements, especially in the morning when the colon is most active. Respond promptly to the urge to have a bowel movement to prevent stool hardening. Physical inactivity. Risk factor: sedentary lifestyles contribute to a range of health issues, including an increased risk of diverticular diseases. Lack of physical activity may lead to sluggish bowel movements and decreased colon function. Prevention: incorporate regular physical activity into your routine. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, jogging, swimming, or cycling. Exercise supports overall colon health by promoting proper bowel function. Smoking. Risk factor: smoking has been associated with an elevated risk of complications in diverticular diseases. The exact mechanisms are not fully understood, but smoking may contribute to inflammation and impaired healing. Prevention: quit smoking to reduce the risk of complications and improve overall health. Seek support from healthcare professionals, smoking cessation programs, or support groups to enhance your chances of successfully quitting. Genetics and age. Risk factor. Family history and advancing age are non-modifiable risk factors. Individuals with a family history of diverticular diseases may have a higher predisposition. Prevention. While genetics and age cannot be changed, adopting a healthy lifestyle, including a fiber-rich diet and regular exercise, can help mitigate other risk factors and promote overall colon health. Medication use. Risk factor. Some medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and certain pain medications, may increase the risk of diverticular complications. Prevention. Use medications as prescribed and consult with healthcare professionals about potential risks. If long-term medication use is necessary, discuss strategies to minimize potential side effects on colon health. Treatment. Diverticulosis management focuses on dietary fiber augmentation, preventing new diverticula formation. Mild diverticulitis symptoms may warrant observation without antibiotics, and a low-fiber diet is often advised until symptoms resolve. In uncertain cases, abdominal CT scans guide antibiotic treatment choices, oral or intravenous. Persistent symptoms may indicate complicated diverticulitis, potentially leading to abscess formation, necessitating drainage or surgery based on the extent and patient's health. Lifestyle modifications for colon health. Regular exercise. Engaging in regular physical activity promotes overall health, including the well-being of the colon. Exercise helps maintain a healthy weight, supports proper digestion, and contributes to bowel regularity. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Stress management. Chronic stress can impact digestive health and exacerbate symptoms of diverticular diseases. Incorporate stress-reducing activities into your routine, such as mindfulness meditation, yoga, deep breathing exercises, or hobbies that bring joy and relaxation. Adequate sleep. Quality sleep is crucial for the body's overall healing and restoration processes. Strive for 7 to 9 hours of uninterrupted sleep each night. Establish a consistent sleep schedule, create a relaxing bedtime routine, and ensure your sleep environment is conducive to rest. Smoking cessation. Smoking has been linked to an increased risk of complications in diverticular diseases. If you smoke, consider quitting to improve your overall health and reduce the likelihood of complications. Seek support from healthcare professionals, smoking cessation programs, or support groups to enhance your chances of success. Hydration. Proper hydration is vital for digestive health. Aim to drink an adequate amount of water daily to maintain regular bowel movements and prevent constipation. Limit the intake of caffeinated and alcoholic beverages, as they can contribute to dehydration. Healthy diet. Adopt a well-balanced diet rich in fiber, fruits, vegetables, and whole grains. Fiber aids in maintaining bowel regularity and preventing constipation. Additionally, consider incorporating probiotic-rich foods, such as yogurt and fermented foods, to promote a healthy gut microbiome. Weight management. Maintaining a healthy weight is essential for colon health. Obesity is a risk factor for diverticular diseases, and maintaining a healthy weight through a balanced diet and regular exercise can reduce this risk. Regular medical checkups. Schedule regular checkups with your healthcare provider to monitor your colon health, and discuss any concerns or symptoms promptly. Early detection and management can significantly impact the course of diverticular diseases. Medication information for diverticular diseases. Antibiotics for diverticulitis. Purpose. Antibiotics are commonly prescribed to treat diverticulitis, especially when the inflammation is mild to moderate. They help combat bacterial infection within the diverticula. Commonly prescribed antibiotics: ciprofloxacin, metronidazole, amoxicillin clavulanate, and trimethoprim sulfamethoxazole are among the antibiotics frequently used for diverticulitis. Proper use. Take the prescribed antibiotics exactly as directed by your healthcare provider. Complete the entire course of antibiotics, even if symptoms improve before the medication is finished. Incomplete courses may lead to antibiotic resistance. Potential side effects. Common side effects may include nausea, diarrhea, or mild stomach upset. Serious side effects are rare but can include allergic reactions. Report any unexpected or severe side effects to your healthcare provider promptly. Adherence. Adherence to the prescribed antibiotic course is crucial for effective treatment. Missing doses or stopping medication prematurely may lead to recurrence or incomplete resolution of the infection. Pain medications. Purpose. Pain medications, such as acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, may be recommended to manage pain associated with diverticulitis. However, caution is advised with NSAIDs, as they may exacerbate symptoms in some individuals. Proper use. Take pain medications as directed by your healthcare provider. Avoid prolonged or excessive use of NSAIDs, as they can potentially worsen diverticular symptoms or lead to complications. Potential side effects. Side effects may include stomach upset, gastrointestinal bleeding, with NSAIDs, or, rarely, allergic reactions. Consult your healthcare provider if you experience persistent or severe side effects. Adherence. Adhere to recommended dosages and avoid self-medicating. If pain persists or worsens, consult your healthcare provider for further evaluation. Bulking agents, fiber supplements. Purpose. Bulking agents, such as psyllium or methylcellulose, may be recommended to increase fiber intake, promoting regular bowel movements and preventing constipation. Proper use. Take bulking agents as directed by your healthcare provider. Increase water intake when using bulking agents to prevent dehydration. Potential side effects. Gas, bloating, or mild gastrointestinal discomfort may occur initially. These symptoms often improve with continued use. Adherence. Consistent use of bulking agents is essential for long-term management. Gradually introduce these supplements to allow your digestive system to adjust. Probiotics. Purpose. Probiotics, available in supplement form or in certain foods, can help maintain a healthy balance of gut bacteria, potentially reducing the risk of diverticular complications. Proper use. Follow the instructions on the probiotic supplement or consume probiotic-rich foods regularly. Discuss with your healthcare provider before starting probiotics, especially if you have underlying health conditions. Potential side effects. Probiotics are generally well tolerated, but individuals may experience mild digestive symptoms initially. Adherence. Consistent use is key for probiotics to exert their beneficial effects on gut health. Dietary recommendations for diverticular health. Fiber-rich diet. Soluble fiber sources. Include foods rich in soluble fiber, such as oats, barley, beans, lentils, and fruits like apples and pears. Soluble fiber dissolves in water, forming a gel-like substance that can help soften stools and ease bowel movements. Insoluble fiber sources. Incorporate foods high in insoluble fiber to add bulk to stools and promote regular bowel movements. Whole grains, bran, vegetables, especially dark leafy greens, and fruits with skins are excellent sources of insoluble fiber. Hydration. Increase water intake when consuming fiber-rich foods to prevent constipation. Adequate hydration supports the movement of fiber through the digestive tract and enhances its effectiveness. Probiotics for gut health. Yogurt and fermented foods. Include probiotic-rich foods in your diet, such as yogurt with live cultures, kefir, sauerkraut, kimchi, and other fermented foods. Probiotics are beneficial bacteria that contribute to a healthy gut microbiome. Probiotic supplements. Consider probiotic supplements, especially if you have a history of diverticular diseases. These supplements can help maintain a balanced gut flora, potentially reducing the risk of complications. Prebiotics. Consume prebiotic-rich foods like garlic, onions, leeks, bananas, and asparagus. Prebiotics serve as nourishment for probiotics, promoting their growth and activity in the digestive system. Moderate FODMAPs intake. Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, FODMAPs. Some individuals may be sensitive to certain FODMAPs, contributing to gastrointestinal symptoms. Work with a healthcare professional or a registered dietitian to identify and manage FODMAP intake, as excessive consumption may exacerbate symptoms. Limit processed foods. Minimize the intake of processed and refined foods, as they often lack the essential nutrients found in whole, unprocessed foods. Opt for a diet rich in natural, nutrient-dense options. Individualized diet plans. Collaborate with a healthcare provider or a registered dietitian to create an individualized diet plan based on your specific needs, preferences, and tolerances. Personalized guidance can help address unique dietary considerations. Food diary. Maintain a food diary to track your dietary habits and identify potential triggers for symptoms. This can be a valuable tool for both you and your healthcare team in understanding the relationship between your diet and diverticular health. In severe diverticulitis episodes, emergency surgery may be required if abscess rupture leads to peritonitis. Colon resection, involving the removal and reattachment of the affected colon segment, is a common surgical procedure. Post-treatment, a high-fiber diet is recommended, with subsequent colonoscopy to assess internal conditions. Considerations for medical consultation: abdominal pain lasting hours, worsening, or accompanied by fever necessitates medical consultation. Prognosis for uncomplicated diverticulosis and diverticulitis with proper treatment and a high-fiber diet is generally favorable. The majority of diverticulosis cases remain asymptomatic, and over 85% of uncomplicated diverticulitis cases recover with conservative measures. However, complications, especially peritonitis, pose serious prognostic concerns. Colon resection significantly reduces symptom recurrence, with surgery typically considered after multiple episodes, or complications leading to internal scarring and colon narrowing. Regular medical follow-up is crucial for optimal management and prevention of recurrence. Conclusion: nurturing colon health in the face of diverticular challenges. In summary, effective management of diverticulosis and diverticulitis is key to sustaining a healthy colon. Early detection through diagnostic tools like colonoscopy is vital, given the age-related prevalence of diverticulosis. While diverticulosis often remains silent, the transition to diverticulitis demands attention due to pronounced symptoms. Lifestyle modifications, including exercise, stress management, and adequate sleep, play a crucial role. Smoking cessation, weight management, and dietary choices, rich in fiber and supplemented by probiotics, form a robust defense. In severe cases requiring surgery, a post-treatment high-fiber diet and vigilant follow-ups ensure optimal recovery. Medical consultation is paramount, especially with worsening symptoms. With proper treatment and adherence to a high-fiber diet, the prognosis for uncomplicated cases is generally positive. Navigating diverticular health requires a holistic approach, encompassing medical guidance, lifestyle adjustments, and dietary mindfulness. Regular checkups and open communication with healthcare providers form the foundation for a journey towards a resilient colon and a fulfilling life. Your health matters. Quali.health